Hello, and welcome to another episode of the podcast, Women's Health and Vitality Unleashed. I am your host, Coach Dr. Ann Hester, double board certified in lifestyle medicine and internal medicine. And I am the creator of PatientWorld.net, and I recently launched some SMART goals. A lot of people have heard of SMART goals for work, but now you can get SMART goals for health. You can go to inspirehealth360.com and sign up for your free bi-weekly fillable gamified SMART goals to help transition your health from where it is now to where you always hoped it would be. So again, welcome to the show. And today I'm excited to have our guest, Dr. Jawad Mustafa. Welcome to the show.
Thank you. Thank you for the introduction.
Okay. So Dr. Mustafa, tell the audience a little bit about yourself.
Well, I've been practicing medicine for about 20 years now. I'm from Pakistan, working in my own clinic. We have a family setup, and for about 4 to 5 years in particular, I am focusing more on breast health awareness, breast cancer awareness, as I have my master's in OBGYN ultrasound. So I get patients, female of different age groups, with different breast health issues and mostly neglected cases neglected by the healthcare professionals in some cases, and sometimes their own negligence or lack of awareness, or you can say the overall attitude towards breast health, as everyone is more concerned about breast cancer only. But there are many other conditions, many other issues that can be identified, that can be harmful right from the teenage till their later middle age or later in their life. So to identify those, to guide women about those health issues, particularly younger females. So I am more focusing on breast health awareness, breast cancer, along with diagnosis through medical ultrasound.
Okay. So we're coming up on Breast Cancer Awareness Month in this country, America, the United States of America. So tell us a little bit about some of the risk factors and what women could do to decrease the risk of developing breast cancer.
Well, to be honest, breast cancer risk is with every female. Any female who is in their teenage, they have an added risk factor being a female, because breast cancer develops in the breast glands, breast ducts, or any surrounding tissue, starting from the skin till the deeper tissue. So as the breast growth starts, the risk factors start right from there, because it is not just about inheriting those genes or having any specific kind of problem inside the breast. It is all about our lifestyle, our choices, our dietary choices, the things we apply on the skin. So all these factors are triggering or influencing hormones, particularly estrogen hormone, that affects the breast growth, that is mainly responsible for breast growth, shaping overall skin texture. So right from the start, right from the development of the breast, there are risk factors that are increasing day by day, year by year. So the main focus is to identify those risk factors that were not present many decades ago, but now, due to our lifestyle, our latest trends with lifestyle, our skincare products, and everything. So there are increasing risk factors, and these changes are starting right from the teenage or from the time the breast development start. So we need to identify those factors, because every female, every person is different. Everyone has a different lifestyle, different environment, different diet, different hormonal setup, different emotional health status. So all these factors contribute towards either improving overall body health and breast health, or causing any kind of harm, or increasing the risk factors that trigger those changes which make normal cells into any kind of cancer cell. So there
Yeah.
are risk factors from in different age groups, different factors affecting different age groups.
So going back to what you were talking about, um, endocrine disruptors, I believe.
Yeah.
Okay. One thing that I love to tell people, I once interviewed a woman who wrote a book. She developed breast cancer, and she believes that it was due to the endocrine disruptors, which a lot of people don't understand at all because it's not a common term. But essentially, what I'm hearing you say is that a lot of products that we put on our skin and just day to day products could be endocrine disruptors and basically impact our hormonal balance and potentially put us at risk of breast cancer.
Yeah, because
And
just a simple thing. Uh, there is an increasing trend, increasing uh, shift towards early menstruation in girls. Like in 2 or 3 decades ago, it was most probably 13 to 15 years of menarche. But now it has gone down till 9 to 10 years. And in some countries, it is even from age 8 to 9 years. So it is a very alarming trend. So
yeah,
as earlier hormonal changes start in any female, any girl, those risk factors increase right from that age group. So it is mostly triggered by emotional health issues. Any person, any young girl who is having hormonal surges, hormonal changes due to emotional stress, either any factor that is causing those stress from home, from school, from any person. So, bundled with those skincare products that are high in demand these days from younger girls, younger females due to social media trends. So, bundled with those, added with the excessive use of plastics, microplastics, along with pesticides. So, these all contribute towards those changes which were not present few decades ago, but now they are happening right from a younger age in young girls, causing all those changes which were not supposed to happen in this younger age group. So these all are causing a lot of risk factors for these girls, not just for breast health, but for their own hormonal health.
yes. One thing I like to tell people, there's this site called ewg.org, the Environmental Working Group, ewg.org. You can go on that site and you can put in the name of a common product you use. And frequently, everything's not in the database, but one day I literally spent hours. I pulled all of my shampoos, furniture polish containers, all those things together, and I sat at a computer and I put them in one by one, and I put them in, and boom, something comes up. This product contains this chemical that is an endocrine disruptor. It contains this chemical that does this and this that does that. So I found it to be invaluable because most people have never heard of endocrine disruptors, and in addition to the breast issue, they were dealing with polycystic ovarian syndrome and many other things. So I think it's really worthwhile to understand that with all the manufacturing and all of the commercialization of so many things and how things are quick and easy now, we're not using a lot of natural products. We're using a lot of things made in a laboratory.
Mhm.
And yes, they may work great. They may make your teeth extra white. They may make your floor shine better. But you need to understand that if you're inhaling, putting something on your skin, ingesting something, all of these things that you come into contact that have the potential to disrupt your endocrine system, get your hormones off balance, that is huge. And what you just said is alarming that some girls are getting their menstrual cycles at the age of 8. So there's a lot of work to be done to educate people on endocrine disruptors and other stress and other things that impact their menstrual cycles and their breast health and the long-term life expectancy and quality of life. We have a ways to go, and I really appreciate what you're sharing with the audience today. So tell us some other risk factors that you see in particular that are potentially modifiable. Yeah, I like to tell people we're born with genes, but just like you have a thermostat on the wall, you can turn the genes up or down based on the choices that you make. So just because
Yeah.
your family
Okay.
member had breast cancer doesn't mean you're going to have it. What you do could increase the risk or decrease the risk, even though you have the genetic makeup that you were born with. So tell us some more information about what people can do to modify the risk of breast cancer.
Okay. So there is a misconception, very common misconception that family history plays a uh, very dramatic role. It is not always like that, because only about 10% of cases have a family history. 90% cases which are happening in our world, in states or in Asia or in any European country, almost 90% are without any family history. So there must be something that is going on which is
Absolutely.
not linked with genes, not related to particular inheritance. So those females, they are mostly having issues which are linked with their hormonal imbalance, either estrogen dominance or lifestyle choices. Like I mostly focus on girls and women in their younger age group. So, just a common observation that in our schools, in our colleges, in university, there is increasing trend of sitting idle or working on their desk, studying for 6 to 8 hours, or
Yes.
in the classrooms. So there is very little activity of the chest muscles, of the arm muscles. So sitting with their head and their shoulders bent downwards, chest downwards, it is causing a constant stress on those muscles, making them weak. So, along with impaired lymphatic drainage is very important because it detoxifies our body from those toxins, from those free radicals, from those cancer cells which are daily made and born in our body, which our immune system fights to reduce, to eliminate them. It is not just in the breast, they are happening in all our body areas. The lymphatic system plays a very vital role, but lymphatic system requires movement, it requires movement of the muscles, it requires movement of the body. So if a person, any female, who is not active, who is not having a regular physical activity, who is studying more hours and not working any kind of other work, doing any kind of physical activity, sitting, prolonged sitting, along with all those dietary choices, like using a lot of processed food, a lot of food that is contained in the plastics, less vegetables, less fruits, more of the preserved food, along with more fatty food, which is from those inflammatory omega 6 rich seed oils, which is commonly used everywhere. So, bundled with all these aspects, we are increasing the risk of getting free radicals, with increasing risk of those cancer cell formation, along with the stress and added stress of career, of study, of our overall routine,
Hmm.
with those beauty standards and those social media standards that they are around us. So all these stress factors, they always make hormones go bizarre. These hormones, especially estrogen excess, along with cortisol excess, they all play a part in making those cancer cells, those free radicals that are circulating in the body, that are present in those breast cells, glands, that are constantly increasing in their number as it is a growing age. So, the increasing number of estrogen, along with those hormonal disruptors, those parabens, those BPAs, those pesticides, those microplastics, they all make these changes, these cancer cell formation more and more aggressive. That's why breast cancer in younger female is mostly more aggressive, because is a lot of stuff going on in the body at the moment. As the body is growing, breasts are growing, hormones are at their maximum level. So it is very hard to control once these balance is shifted towards cancer cell formation. So it is not just about making one choice right. It is about knowing and learning different choices that any person, any female can make right from their teenage. It is a step by step, it is a brick by brick foundation that any person should lay right from their teenage, and then consolidate on that so that they can have more and more healthy life in their 40s, 50s, and onwards.
I
So
think
it is
that
not just
incredible.
one thing.
I love that. And I think it's very, you make an excellent point that this starts young. I'm an
Yes.
internist by training, also board certified in lifestyle medicine. But I remember in training when they told us that they did autopsies on teenagers and they already found blockage in the arteries, coronary artery disease. And they may not have a heart attack till they're 60, but they already had the makings in their teenage years. And likewise, as far as the breast cancer, parents need to understand, young people need to understand whole food, plant based, plant predominant diet. I'm not saying everybody has to be a vegetarian, but when you're eating the rainbow, you're eating lots of natural fruits, vegetables, and grains without the herbicides, without the pesticides, you are pouring all these antioxidants and all of these nutritional components into your body, as opposed to the fried foods that when you fry them, these chemicals are made that increase the risk of cancer and so forth. It needs to start young. You don't wake up one day with a breast cancer. And so it's really important for people to teach their children and to prepare those meals at home and to encourage them to eat more fruits and vegetables and less of the processed, ultra processed foods, the stuff in bags and boxes and so forth. Because if we can do that to the younger generation, we cannot shield them from all the plastics around. You walk into a room and there's the new carpet smell. Well, there are these chemicals in it. The new car smell. We cannot shield them from everything, but we can do a lot. And your comment about girls getting periods at the age of 8, that's scary. I mean, when I was growing up, it was like 14. Um,
Yeah,
I'm in my 60s, but still, that's a huge jump. So just imagine where we'll be in a few years if we continue along this trend. So thank you so much for bringing up the importance of addressing this at a young age. I have teenagers. A lot of people out here, they have young, girls, teenagers, and even toddlers, whatever the case may be. But when we teach them young, we can literally help prolong the life expectancy. And we need to have that
definitely.
mindset that we have the power to direct our children's choices. Always going to want the burger and fries. I'm not saying that you're going to take that out of the way if you're in America or wherever you are, that there's going to be this strong advertising to eat the junk food. But we can instill a foundation that they will draw upon, and that can really impact the rest of their lives.
Definitely. Actually, there are two extremes. People either eat all the healthy stuff only, and they stress themselves with all the labels and everything all the time. And the other extreme is okay, forget it. We'll get what is destined for us and everything. But the thing is to have a balance. Like any person, they get cravings. They want to have something good. They want to have something extra spicy or cheesy and everything. It's all right. They can have those food, but in a balance.
Yeah,
Like
moderation.
once or twice a week, they can snack on anything, but on the rest of the days, they should know that their body needs detoxification, their body needs rest, their metabolism, their hormones need some rest. So, to provide that balanced, adequate sleep at a proper time, the nighttime sleep, that is mandatory. Secondly, exercise. Even for a 5 to 10 minutes daily, any exercise, especially focusing on if any person, any female who wants to improve their breast health. So, exercise of the upper body, these pectoralis muscles, it is very important because it helps in the circulation along with proper drainage of the lymphatics. So, very little exercise, daily dietary modifications, lifestyle modification, like they should sit with a proper back posture. Bad posture, it is a killer for those muscles of the chest, of the pectoral muscles, the arms, the shoulders, the neck. So all these things, small changes right from the start, they play a very vital role. There are two main points I want to highlight that it is very alarming trend these days in younger females, not just in the teenage, in their 20s also, use of a lot of skincare products. these skincare products, they should be filtered, because we cannot rely on the labels, we cannot rely on those marketed campaigns. Every product which is available, it has something inside that is making its shelf life of months to years. So that is, as any kind of preservative, that is not present in our daily routine use products, because anything that is fresh, it will rot, it will start to degrade in a couple of days to hours to days. So if we are increasing the shelf life of these items, we are adding something which may or may not be harmful. But using those products like lipsticks, they have a lot of heavy metals, deodorants, everything. We can use them, we can guide them to use them, but in moderation. Sometimes it's okay. Use skincare products, it's all right. Using lotions and creams, because skin is the largest organ to absorb anything
Mm-hmm.
we put on it. So small amounts, whenever it is required, it is all right. But excess, particularly those items which are not regularized, which are not from a good credible source, which are not having any kind of label, proper labeling, so avoid those. Secondly, it is a very alarming trend that more and more girls and women, like in my practice, I see many women, particularly online patients and those who contact from different groups. So, the one thing that is identifiable is the lack of proper self breast care. So, it includes regular exercise, breast massages, lymphatic drainage massages. It is not hard to learn. It is easy to do on a regular basis while taking shower. Couple of minutes of massage, couple of minutes of lymphatic drainage massage, couple of minutes of massage exercise of the upper body. It doesn't take much time, but it will increase the overall breast health to healthy and healthier on daily basis. It is not hard to do. Very easy steps. I get them on a regular basis, along with any person who is either a student or having an active lifestyle or an athlete or any person. If they are wearing inappropriate bra, it is causing cellular damage on a regular basis and an alarming pace if that thing starts from teenage. Because whenever there is impaired drainage circulation of the breast ducts, breast glands, and lymphatics, if any uh, garment, any bra, any upper body garment that is impairing that circulation drainage, it is increasing the risk of getting free radicals due to stagnation, due to those hormonal factors that are causing cellular proliferation in the glands or ducts. So we need to detoxify the body. We need to help in detoxification through lymphatics, through proper circulation, and any factor that is disrupting this thing will cause damage on a large scale, on a regular basis, and it can result in cancer cell formation.
That's all great information. It's wonderful. I thank you so much for coming. One more thing I want to add is alcohol intake can increase one's risk of breast cancer. We've often said
Definitely.
women should have no more than one glass a day because the liver and everything else. But now we know that breast cancer has been associated with alcohol intake. And so one at most, preferably none, or one every now and then, but certainly not one or two drinks a day. I also read something recently that they have found an association with smoking and breast cancer. So new information is coming out all the time. Something I
Uh,
do to encourage women is to get your mammograms. Um, a lot of people,
Ultrasound and mammograms, both, because younger women have dense breasts, so mammograms mostly don't work with younger women, even in their 40s. So, mammogram for screening bundled with ultrasound. Ultrasound can be done right from the teenage, any age group. It is safe without radiation, and it can detect those changes which are not cancerous. Like if any person, any female has a fibroadenoma, it can be identified. Fatty changes, if any kind of lump due to any duct blockage, and also those fibrocystic changes, those changes that are happening due to excess or dominance of estrogen, those can be identified, and with lifestyle modifications and other self breast care methods, we can reduce the formation of all these other aspects, these lumps, nodules, fibrocystic changes, and duct blockage, and all the stuff. One thing just to add to the smoking is very harmful, hazardous to any person, but that passive smoking is also same harmful. Like if a female is not smoking herself, but if she is present in that
Okay.
environment where
Mm-hmm.
there's a lot of smoke, she is inhaling all those chemicals which are present in the air. So it is not just active smoking, passive smoking also has all those hazards added with
Secondhand
them.
smoke. Okay. This was great. I really appreciate all the valuable information you gave. I want to turn the attention before we leave to your latest book. Can you tell us a little bit about that and where people can get it?
Yeah, it is my book about it is for breast ultrasound essentials. So it is recently published on Amazon, available there. It is basically for all those healthcare professionals, sonographers, students who want to learn about breast ultrasound, and especially it has lot of tables, charts for comparison, along with decision tree, feedback loops, that any if some person, any doctor, any healthcare professionals come across a patient, any case which they have to make or label or mark what to do next with it. So it has all those necessary steps in the form of charts and short diagrams, flow charts for easy diagnosis and easy decision making. So it is not just for information, it helps in decision making as well.
Okay. All right. And tell us the name again. And it's on Amazon, right?
Yeah,
Is it available on Kindle or is it the hard copy?
it is at the moment it is a paperback, but
Okay.
the ebook will be available soon. So it is Breast Ultrasound Essentials.
Okay. All right. And how can people reach out to you if they need more information? Or they just
Well, they can contact me through LinkedIn or Facebook. I'm active on those. Mostly patients contact me through different Facebook groups. I volunteer and work with about breast health and breast cancer. So Facebook and LinkedIn both are platforms to reach me.
sounds great. Do you have any last words for the audience before we go?
Well, don't rely on those advertised campaigns that breast cancer occurs above the age of 40s and 50s, and mammogram above the age of 40. The risk factors start right from the time breast development starts, right from the teenage years. So the time to act is in the early time before the thing starts. Early early prevention is the only way to cure any kind of disease. So the only way to have early detection is self breast awareness, and it should start right from the teenage years.
Okay. All right. Thank you again so much. And you have a lovely day.
Thank you.